I am the nursing supervisor. So I have worked locally in the Stockton area for almost 20 years in day practice and emergency medicine, and then took a little time off and went and taught over at our local technical school, and then started doing shelter medicine and fell in love with it. So they offered me a position to come in and be a nursing supervisor here and help them with improving patient care and things like that. So there's really an amazing group of people that come together and work together as a team to really try to get as many animals, out of the shelter and into homes if at all possible. You've got anybody from your behavior analysts and people like Chris who are working at live release and working with other cities and states and countries to get these animals placed. You've got multiple surgeons coming in. You've got people who are willing to transport animals that are retired all over. I mean, that's amazing. Just call up somebody and say, hey, I have a dog that needs to go to San Francisco for a fracture repair. He'll be there in like 20 minutes and come take the dog over there, or to UC Davis for fracture repair or evaluation. You've got all of these doctors who are willing to work with us so that we can, there's so many people that pitch in. And I think that the public's perception sometimes is that it's more of a dungeon. And that the animals kind of come in and sit in a cold, dark place and just shiver, that we don't really do anything. And I think it's far from. These animals get excellent care. I think comparable to or better than care in most of the day practices that I've worked at, because you're not limited by what a client thinks the animal should get. It just gets what it should get. So if it comes in and it's bit by a dog that needs a drain placed and pain medication, antibiotics, that's what it gets. It's not a client telling you, oh, I don't want to pay for a drain placement or a wound. It's, I only do antibiotics, he'll be fine. You just do what he needs. And so that's awesome to be able to do that. And just being able to work with people who care so much, who are willing to stay late on their day off, transport dogs. And everybody works hard together to try to get a positive outcome for every patient, which I think is amazing.